Hello, and welcome to the GRACE podcast series. My name is Denise Brock, and I am the Operations Director for the Global Resource for Advancing Cancer Education, or GRACE. In this podcast series, we interview patients, advocates, and healthcare professionals to provide the most updated information for our community and to highlight important issues facing those dealing with a cancer diagnosis. We hope you find this information valuable. For questions or comments, please visit us at cancergrace.org.
You just highlighted the importance of getting screening imaging for breast cancer. Could you talk more about the different imaging tests that are available to women for detection of breast cancer?
Right. So overall, I would say there are three imaging modalities that are commonly used for breast cancer. One is the mammograms, and the other ones are ultrasounds and MRIs. So the most common screening modality that is used to detect breast cancers for screening is by far the mammograms. So mammograms are nothing but low-dose X-rays that are used to look for abnormalities in breast cancer. So basically, the mammogram machine has two plates that compresses the breast tissue so that the tissue is spread apart and we can look at the abnormalities. The traditional mammograms used to be 2D films. Nowadays, we do have 3D mammograms that are called as digital tomosynthesis, and they are becoming quite popular due to a number of reasons. Studies have shown that 3D mammograms, when we compare them with 2D mammograms, they may be more helpful in women who have dense breasts. They are more likely to find cancer, and they have less probability of finding false positive abnormalities. So breast ultrasound is another imaging modality that can be used, even though I must say it is not used commonly for screening purposes. Ultrasounds do not use any radiation. They use a probe and sound waves to generate images of the breast tissue. Usually, breast ultrasounds are used when we see an abnormal area on the mammogram and we want to look at that area in more detail. They may also be used to do biopsies of suspicious areas. For screening purposes, they can really be used when women have dense breasts. So the third modality are breast MRIs. So MRIs use strong magnets instead of radiation in order to generate images of the breast tissue. Patients do need to get a dye before getting the imaging. Breast MRIs can be used for screening, as I said earlier, for high-risk women, but otherwise they are more commonly used once we see an area of abnormality, either on the mammogram or the ultrasound, and we want to look at the suspicious area in more detail, and they could also be used to do biopsies of the suspicious areas.
Thank you again for joining us. This podcast was made possible by the generosity of sponsorship from our friends at Lilly and Exelexis. Please like and follow us on Facebook and Twitter. Send us feedback, share your story, donate, and visit us for more information at cancergrace.org. Thank you for listening.